All right, so we have a 39-year-old woman who presents to the emergency department with right leg pain and mild swelling. She denies any previous medical history or trauma. She does not take any medications. Examination is remarkable for tenderness along the right calf venous distribution and minimal swelling of the right lower leg. What is the most appropriate diagnostic workup for this patient? All right. So this is a good question. It's a complex question and requires some knowledge of Wells criteria of how to manage deep vein thrombosis. So let's look at the question first and see what we could take out of this. So we have an otherwise healthy woman. She has no previous medical history or trauma, is not on any medications. And remember, when we're given information on a standardized exam, it's given to us for a reason, just like information that's not provided is not provided for a reason. So what we're provided with here is tenderness along the right calf venous distribution and minimal swelling of the right lower leg. So if we review Wells criteria, right, the pretest probability of a DVT, we'll see that this patient actually is considered moderate risk for a DVT. She has 2 points, and therefore the workup, the diagnostic workup, is going to reflect her moderate probability. Now you need to know what the algorithm is for moderate probability. And glancing at these answer choices, I see that there's duplex ultrasound in here, that there's a D dimer. And this is the important point. I'm going to start off by saying this. So a D dimer is a test that has high sensitivity but lower specificity, right? So ideally, it should be used as a rule out test and not a rule in test. Okay. So if we use that as the premise, let's go through our answer choices and see what we could come up with. So answer choice A, duplex ultrasound to evaluate for DVT. And if negative, send a D dimer. If the D dimer is positive, treat for DVT. All right, let's dissect this. So if we have a duplex ultrasound that is negative, that's a really good position to be in to not have a DVT. If for some reason there's still clinical concern and a D dimer is sent and that D dimer is positive, that does not confirm the diagnosis of a DVT, right? Because the D dimer is sensitive but not specific. So in this case, the proper management would be to perform serial ultrasounds, let's say, if you suspect that this patient is truly at moderate risk, because if she had, let's say, a small DVT that wasn't spotted on duplex ultrasound and she's moderate risk, that DVT, that thrombus could propagate and it will be caught on a repeat ultrasound. So that's the thinking there. So answer choice A, we're going to cross out as not being the most appropriate. Answer choice B, duplex ultrasound to evaluate for DVT, and if negative, the patient may be discharged. All right. Well, along with the reasoning of answer choice A, it's a good thing that the ultrasound is negative to start with, but because this patient is moderate risk, there is the possibility that you could have a thrombus that is just not being picked up and it may propagate over time due to her risk. And therefore, you would want to have a repeat ultrasound performed for this patient to see if there is any propagation. So she shouldn't necessarily just be discharged without any other follow-up. So there is some truth here in that you may discharge this patient, but there should be follow-up arranged, and that is not part of this answer choice. So we will cross that out as well. Let's go to answer choice D. Send a D dimer. If positive, treat for DVT. So a D dimer is a rule out and not a rule in. So we shouldn't make any treatment decisions based on the positive D dimer. So just from that, we're going to cross this off as Incorrect. That leads us with answer choice C. Send a D dimer, and if negative, the patient may be discharged. So in low to moderate risk patients, if we send a high sensitivity D dimer, then if it is negative, it essentially rules out a deep vein thrombosis. And if there's a low likelihood, a very low likelihood of DVT, then this patient may be discharged. So this would be the most appropriate diagnostic workup, answer choice C, and let's confirm. And sure enough, that is the case. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.